It's the time we always bring in a member of the medical community to talk to us today. Dr. Michelle Fillion with the Zimmer Cancer Center at New Hanover Regional Medical Center. We turn the calendar page. It is now Breast Cancer Awareness Month. It's the month of October. Thank you for coming in.
Yes.
We were talking during Gannon's segment, Bob's segment, about just so many things with breast cancer. We seem like this day and age, we are inundated with how to treat it, where to treat it, what's the best thing to do. And there can be a lot of confusion in this with so much is out there.
Yes, that is true, and almost like sometimes too much out there that it's not as simplified. The biggest thing with breast cancer is really a disease of women. Men can get breast cancer, but women are 100 times more likely to get breast cancer, and it's also a disease of older age. So really women age 55 and older are ones that are going to be most common. About 80% of those are going to be women with invasive breast cancer. So it's really an age, age is a big important factor to breast cancer. There are other risk factors that are involved as well. Family history is involved, but only 15% of all women with breast cancer have a family history. That means 85% do not have a family history. So it's very important to do prevention and early detection, and we do that with mammograms.
I was going to say, with you saying that it tends to be in older women, at what age as a woman do you want to start having those screenings?
Well, and there's actually a lot of controversy right now in the medical community versus where we're saying 40 or 50. So really women age 40, between 40 and 50, to speak with their medical doctors, assess what their risk factors are to determine when they are ready to get mammograms. Since I'm a breast cancer surgeon, I tend to favor the age 40 of doing the annual breast cancer to doing the annual mammogram, and then doing clinical breast exams with a skilled practitioner.
I always ask, with things like with cancer and things like that, where, people may just have an ailment, feel like they're down, but are there things specifically for a woman or man, as you mentioned, that can have this? If you're at home, things for you to look for?
Just any changes in the breast, that's going to be the biggest thing. So if a woman just gets comfortable feeling her own breast, say once a month, not around her menstrual cycle, and any differences that they note. So if they feel a hard lump or a mass, that's going to be the biggest thing. Breast cancer can present sometimes as just teeny little calcifications on a mammogram, so that's why it's so important to get the mammograms as well. But things that women can do to stay healthy are just eat well, not be obese, be nice, active, healthy living is the best thing that we can promote.
And again, when we hear the word cancer, so many of us, our minds right away go towards, I'm doomed, this is a fatal thing. That's not necessarily the case.
No, it's not. Early breast cancer, stage 1, has a 99% survival. So it's very easily treated and curable. So using multiple modalities together, whether it's surgery, chemotherapy, radiation, hormone therapy, they all coupled together really improve the treatment of breast cancer for women today.
And one of the things that the doctor and I were talking about was, it seems, and I said, maybe we in the media are to blame for this, you always hear, oh, someone's diagnosed and right away there's a decision to have a double mastectomy.
Yeah.
And that doesn't necessarily have to be your fate.
No, it doesn't. And for women who have breast cancer, there are partial mastectomy or lumpectomy, where we can still preserve the breast. For women that undergo bilateral mastectomies, there's only a select population that's really targeted for, particularly the women that have genetic mutations that are prone to it. Otherwise, it may be a little on the overkill side. And
it still surprises me that with as much that's out there, and we hear so much of cancer as hereditary, that only 15% of people have a family history of this.
Yeah, it's very surprising, but this is a cancer that happens sporadically, and again, the older you get, the more likely that you are going to be to develop breast cancer, so thus, early detection is key.
And again, because this is Breast Cancer Awareness Month, you are going to see literature and commercial, it's going to be everywhere. What you always want to do, you always want to go to your physician if you have any questions about that.
Certainly.
You don't believe everything you read, don't believe everything you hear. Take it from the doctor, she knows best. We're back with more after.